Hey everyone, and welcome back to the Deep Dive. Today, we're going to be tackling something that's been on everyone's mind. And let's be honest, it's kind of a headache,
Mm-hmm.
the U.S. healthcare system.
Yeah.
Every day it seems like there's a news story about rising costs, denied claims, surprise bills, you name it.
Right.
And, with the recent murder of UnitedHealthcare CEO Brian Thompson,
Yeah.
it's pretty clear that people are feeling pretty strongly about this.
Yeah.
And while violence is never the answer, it does kind of show how frustrated people are.
I think so.
You sent us a ton of articles about this, so let's dive in and see if we can unpack this whole thing. So
Yeah.
we've got excerpts from policy papers, think tank reports.
Right.
We even have some personal stories from patients trying to navigate the system.
It's a really complex issue.
It is.
And I think to understand it, we have to kind of understand how we got here.
Okay, so let's go back in time.
Yeah.
Where do we even begin?
Well, believe it or not, World War II actually plays a big role.
Right.
Yeah. So during the war, there were wage freezes in place.
Right.
So companies couldn't raise salaries to attract workers.
Mm.
So they started offering health insurance as a perk instead.
So the system we have now is kind of a result of a wartime policy.
That's right. It's not something you hear every day.
That's pretty wild.
And then fast forward to 1954, Congress makes another decision that still affects us today.
Okay.
They made health insurance premiums tax deductible.
Wait a minute.
Mm-hmm.
A tax break from the 1950s is still shaping our healthcare in 2024.
It is.
Wow, that's crazy.
It really is. And these two seemingly small decisions basically set the stage for the employer-based system we have now.
Right.
But of course, on top of that, you have decades of medical advancements. People are living longer, and it all adds up to a really complex system.
Okay, so we've got private insurers, government programs like Medicare and Medicaid.
Right.
It sounds like a recipe for a headache.
Yeah, it can be.
So where do things stand right now?
Well, about half of Americans get their health insurance through their employers.
Okay.
The rest rely on government programs or the military, or unfortunately, some people have no coverage at all.
No coverage at all.
Yeah, it's about 8% of the population.
Wow.
And while a lot of people with employer-sponsored insurance are happy with it, there's this growing problem that's causing a lot of stress.
Oh, yeah. Denied claims.
Denied claims.
Yeah.
It's like the worst possible thing when you're sick and you need treatment,
Right.
and your insurance company says, nope, not covering that.
It's really scary, and it's a lot more common than you might think.
Really?
Yeah, one study found that 17% of insured people had a claim denied in the past year.
17%. That's a lot of people.
It is.
And I mean, it's one thing if it's just a financial burden, but it can actually make people's health worse.
Absolutely, it's a double whammy.
Yeah.
Almost half the people whose claims were denied said their health got worse because of it.
It's heartbreaking.
It is.
So why are so many claims being denied?
Well, sometimes it's an honest mistake,
Right.
like a coding issue or missing paperwork.
But sometimes it's more deliberate.
Really?
Yeah, insurance companies might use tricky wording in their policies or require pre-authorizations for things that should be routine. Or they might just deny the claim outright and hope the patient doesn't fight back.
It sounds like there's this huge power imbalance
There is.
between the patient and the insurance company.
It's true.
And on top of all that, there's the problem of surprise medical bills.
Oh, yeah.
You think you're covered, and then bam, you get hit with this huge bill.
It happens all the time.
45% of insured people have reported getting these surprise bills.
It's like a game where the rules are constantly changing and you can never win.
It's so frustrating.
It is.
It makes you wonder if the system is actually designed to keep people healthy,
Right.
or if it's just about making money.
That's a big question.
So if you do get hit with a denied claim or a surprise bill, is it even worth fighting back?
Oh, absolutely. You should always fight back.
Really?
Yeah, don't just accept the denial as the final word. You have the right to appeal, and a lot of times it works.
So there's hope.
There is.
What are the chances of winning an appeal?
Well, research shows that 38% of people who challenged a surprise bill got some money back. And 50% of people who appealed a denied claim got it covered eventually.
So it's worth fighting for your health.
It absolutely is.
Don't just give up.
That's right.
But shouldn't there be bigger changes to prevent these problems in the first place?
Definitely individual action is important,
Right.
but we need system-wide solutions too.
Okay, so what are some of those solutions?
Well, one idea is for the government to keep track of how many claims each insurance company denies.
And then make that information public.
Exactly. It would make them more accountable.
Like they'd be less likely to deny claims if they knew everyone was watching.
Right. Some people want stricter penalties for unfair denials.
To make it less profitable for insurance companies to put profits over patients.
Exactly.
But of course, this whole issue is tied up in politics.
It wouldn't be the U.S. healthcare system without it.
So what are the main points of disagreement?
Well, on one side, you have Democrats like Bernie Sanders who are pushing for Medicare for all.
Right, Medicare for all.
It's been a hot topic for a while.
It has. What's the main argument there?
The idea is that if everyone is covered by a single government-run system, it would take the profit motive out of healthcare.
That sounds good in theory.
It does.
But it seems like a huge change.
It would be.
Like a total overhaul of the system.
Yeah, critics say it would be way too expensive and that it could lead to longer wait times for treatment.
I see.
Plus, some people are happy with their employer-sponsored insurance and don't want to lose it.
So there are trade-offs to consider.
Always.
What are we willing to give up to get better health care?
That's the million-dollar question.
It really is.
And then there's the Affordable Care Act.
Obamacare.
Yeah, that was a huge piece of legislation.
It was? Didn't it expand coverage to a lot of people?
It did. 45 million people got insurance because of the ACA.
Wow.
And the uninsured rate went down to 7.7%.
That's great.
It was a big step forward, but there's been a lot of pushback, especially from Republican-led states.
They haven't fully implemented it.
Some haven't, and that means some low-income people are still without coverage.
That's a shame.
It is. And to make matters worse, the ACA's middle-class subsidy is set to expire in 2025.
Wait, so millions of people could lose their insurance in a couple of years?
That's the worry. It's like a ticking time bomb.
Ugh. It feels like we're always just putting Band-Aids on the problem.
I know we need our long-term solution.
But how do we get there when there are so many different interests at play?
It's tough. You've got insurance companies, doctors, pharmaceutical companies, politicians, patients. Everyone wants something different.
It's like trying to herd cats.
It really is. True, reform requires everyone to agree, and that's almost impossible in today's political climate.
It's easy to feel hopeless listening to all of this.
I understand.
Where do we even begin?
I think the most realistic approach is to take small steps.
Okay, baby steps.
Yeah, focus on what's working and try to fix the worst problems one at a time. Like what? Well, we've already talked about transparency around denied claims and stricter penalties for unfair practices.
Right.
Those are good starting points. We can also look at existing policies like the ACA and make sure they're working as well as they can.
That makes sense.
It's about closing loopholes and making sure people are actually getting the coverage they need.
So it's not going to be easy.
It's not.
But it's possible.
It is. Every step we take brings us closer to a better system.
I like that attitude.
I think it's important to stay positive.
So we've talked about the history, the challenges, some possible solutions.
Right.
But what does all of this mean for the listener?
That's a great question, and it's a perfect lead-in to our final thoughts.
Okay, so let's bring it back to you.
Yeah.
The person listening to this right now.
How can you navigate this crazy system and take control of your own health?
We'll get into that after the break. We're back and still wading through this complicated U.S. healthcare system.
It's a lot.
Before we, well, not really a break since it's a podcast, we were talking about those baby steps, those small changes that could actually make a difference.
Incremental change.
Yeah. So let's get specific. What kind of things are experts suggesting?
Well, one idea that's gaining some traction is something called value-based care.
Value-based care.
Yeah, it's basically shifting the focus from quantity to quality.
Okay, so instead of just looking at how many tests or procedures you get, it's about whether the treatment actually worked.
Exactly. Did you get better? That's what matters.
That makes sense, but how do you measure that?
That's the tricky part.
Fine.
Right now, a lot of providers get paid for each test, each procedure.
Fee for service.
Right. And it doesn't matter if it was really necessary or if it even helped.
So we need to change how we pay for healthcare.
Exactly. We need to reward value, not just volume.
So pay doctors for keeping people healthy, not just for treating them when they're sick.
That's the idea, but it's a huge shift.
Yeah, I imagine.
For one thing, you need a ton of data to track outcomes and measure quality.
Right.
And we need to agree on what quality even means.
Which is probably not easy.
Not at all. And then you have to convince doctors to change how they do things.
And people don't always like change.
Especially when it comes to something as big as the healthcare system.
Yeah, we're talking about a whole network of hospitals, insurance companies,
Right.
drug companies.
A lot of moving parts.
It is. And speaking of drug companies, What about the cost of prescription drugs?
Oh, yeah, that's a huge problem.
It is. The U.S. spends way more on drugs than any other developed country.
And it's a major reason why healthcare costs so much.
I think we've all had that moment at the pharmacy.
Oh, yeah.
When you see the price and you're like, what?
What's shock?
It's especially bad if you need a medication long term.
Right, for a chronic condition.
Yeah, and you're stuck with this high copay every month.
It's really tough. But why are drug prices so high here?
Yeah, what's different in the U.S.?
Well, one reason is that our government can't negotiate drug prices. It's true in a lot of other countries, the government negotiates with drug companies to get lower prices for their citizens.
Makes sense.
But here in the U.S., Medicare, which is the biggest government insurer,
Right.
they're actually not allowed to negotiate.
That seems crazy.
It is. A lot of experts and lawmakers want to change that.
So that's one reason.
Another factor is patents.
Okay.
Drug companies get patents for their new drugs.
Right, which gives them a monopoly.
Exactly. They can charge whatever they want for a certain period of time.
I guess it's to help them recoup their research and development costs.
That's the idea. But it also means that drugs are really expensive.
Right.
And then there's direct-to-consumer advertising.
Oh, yeah.
All those TV commercials for prescription drugs.
I see them all the time.
They drive up demand for the expensive brand name drugs, even if there are cheaper generics available.
So it's a whole bunch of things all contributing to this problem.
Yeah, it's a perfect storm.
So what can we do about it?
Well, allowing Medicare to negotiate drug prices would be a big step. It could save a ton of money.
Right.
Another idea is to look at how long patents last.
To maybe shorten that exclusivity period?
Exactly. So generic drugs can come on the market sooner.
Makes sense.
And some people think we should crack down on those direct-to-consumer ads.
So there are things we could do.
There are. It's just a matter of making it happen.
Which is easier said than done.
It is.
But what about technology?
Mm-hmm.
Everyone's talking about AI and telehealth these days.
It's definitely changing things.
Can technology actually help fix the healthcare system?
It has the potential, but it's not a magic bullet.
Okay.
Telehealth, for example, has been great for expanding access to care.
Especially in rural areas.
Right, where there aren't as many doctors,
Yeah.
but it can't replace in-person visits for everything.
So it's a tool. A useful tool.
But not a solution on its own.
Right. What about AI?
Yeah, what's happening with that?
It's showing a lot of promise in things like medical imaging,
Okay.
diagnostics, even drug discovery.
It can help doctors read images more accurately, catch diseases early, develop new treatments faster.
That's amazing.
It is, but it's still early days.
Right.
And there are ethical concerns we need to think about.
Like what?
Well, we need to make sure that AI algorithms are fair,
Okay.
that they don't discriminate against certain groups of people,
Right.
and we need to protect people's privacy.
Of course.
Make sure their data is being used responsibly.
So AI could be great, but it could also create new problems.
It's a double-edged sword.
It is.
Yeah.
But even with all the advances in technology, I don't think it can fix the fundamental problems with our healthcare system.
You're right, technology can help, but we still need to address the bigger issue.
Like the profit motive,
Exactly.
the lack of transparency, the administrative burden,
It's all connected.
and then there's the political divide.
Of course.
It feels like every time we try to make real progress,
Yeah.
we get stuck in this partisan bickering.
It's frustrating.
It is so...
Yeah.
Is there any hope of bridging that gap?
I think it's essential if we want real change.
Okay, but how?
Well, we have to start by finding common ground.
Easier said than done.
It is, but there are some issues that everyone agrees on, like
Yeah.
expanding access to mental health care,
Okay.
addressing the opioid epidemic, investing in preventative care.
Those are good examples.
Those are things that most Americans can get behind.
So maybe if we focus on specific issues, instead of trying to overhaul the whole system at once,
It might be more effective.
makes sense.
And we have to remember that patients need to be at the center of this conversation.
Absolutely.
It's their health that's at stake.
So how do we make sure their voices are heard?
Well, for one thing, we need to create more opportunities for them to share their stories.
Okay.
Whether it's through town hall meetings, online forums, or just talking to their doctors.
Right.
Patients need to feel empowered to speak up.
But how do we turn those stories into action?
That's where patient advocacy groups come in.
They can help.
They amplify patient voices, they educate lawmakers, they push for policies that benefit patients.
So it's a team effort.
It is.
Patients sharing their stories, advocacy groups pushing for change.
And hopefully some lawmakers who are willing to listen.
It's a long shot.
It is, but I think there's reason for hope.
Really?
Yeah, we're seeing more and more people demanding change.
That's good.
The status quo just isn't working.
So it's not all doom and gloom.
Definitely not. I think we're at a turning point.
Okay.
The challenges are huge, but so are the opportunities.
We can actually create a better healthcare system.
I think so, one that's fair, affordable, and focused on quality care.
That's a great vision.
It is, and it's something worth fighting for.
So we've talked about the big picture.
The system as a whole.
Now let's bring it back to you,
Yeah.
the listener.
What can you do right now to navigate this system and take care of your own health?
We spent this whole episode talking about this massive, confusing healthcare system,
Yeah.
all its problems, and maybe some solutions.
Hopefully some solutions.
But now it's time to make it personal.
Right. Bring it home.
What can you, the listener, do right now to navigate this system
Yeah.
and actually take care of yourself?
Well, it's easy to feel overwhelmed by it all.
Totally.
But the first thing is to remember that you have power.
Okay.
You have the power to make decisions, to ask questions, to demand better care.
So be proactive.
Exactly. Don't just sit back and let things happen to you.
Be an active participant.
Yes. And one of the most important things you can do is to be a smart healthcare consumer.
Okay, a smart shopper.
Right. Understand your insurance policy, know what's covered, what's not.
Deductibles, co-pays, all that fun stuff.
Yeah. And don't be afraid to shop around for the best prices.
On procedures, medications, all of it.
Everything you shop around for everything else.
Yeah, cars, groceries, vacations.
Exactly. So why not healthcare?
Good point.
And never be afraid to ask questions.
If you don't understand something,
Ask your doctor, your nurse, your pharmacist, whoever you need to ask.
get your help.
Exactly. You have the right to know what's going on.
And what about when things go wrong?
Like a denied claim or a surprise bill.
Yeah, those are scary.
They are. But the first thing is don't panic.
Okay, breathe.
Right? Take a deep breath. Get all your paperwork together.
Insurance policy explanation of benefits medical records?
Yep. And then call your insurance company.
Ugh.
Explain the situation calmly and politely.
So try the nice approach first.
Exactly. A lot of times, that's all it takes.
But what if they don't budge?
If that doesn't work, don't give up.
Okay,
You can appeal the decision.
they have to let you do that.
They do. Your insurance policy should outline the process.
Okay,
And there are resources to help you, like patient advocacy groups or legal aid.
so this might take some effort,
It may.
but it's often worth it.
It is. You have rights.
So we can fight those individual battles.
Right.
But how can we as patients push for bigger changes?
One of the most powerful things you can do is share your story.
Okay.
Talk to your friends, family, your community about your experiences.
Get people talking.
Exactly. The more we talk about these issues, the more pressure there is to fix them.
So break the silence.
Yes, and get involved with advocacy groups.
There are groups working on this.
Oh, tons of them. Find one that aligns with your values and join the fight.
Donate, volunteer, spread the word.
All of the above.
So find your voice and use it.
That's right.
But in the meantime, while we're working on all that,
Mm-hmm.
what can we do to take care of ourselves right now?
Don't underestimate the power of preventative care.
The basics.
The basics: eat healthy exercise, get enough sleep, manage your stress.
It sounds simple.
It is, but it makes a huge difference.
Take care of yourself before you get sick.
Exactly. And if you have a chronic condition, be proactive.
Work with your doctor, stay informed.
Yes. Knowledge is power, especially when it comes to your health.
So it's a lot to think about.
It is.
Being a smart consumer, fighting back when you need to, advocating for change.
And taking care of yourself.
It's a lot to handle.
It is. But remember, you're not alone.
There's a whole community out there.
Right. And lots of resources to help you. Just got to reach out.
Well, we've covered a lot of ground today.
A lot.
This healthcare system, it's complicated. It's frustrating.
It can be scary.
It really can be. But there are people working hard to make it better.
Doctors, nurses, researchers, policymakers, patient advocates.
And people like you.
Exactly. Everyone has a role to play.
We've talked about the problems, we've looked at some solutions, and we've hopefully given you some tools to take control of your own health.
So now it's up to all of us to create a system that actually works for patients.
That's a great goal.
It is.
Thanks for joining us on this deep dive,
We hope you learned something.
and that you feel empowered to make a difference.
Remember, your health is your most valuable asset.
So protect it,
Advocate for it.
and don't give up.
Until next time, stay informed, stay engaged, and stay healthy.